In this segment, we will be discussing 3 actual signs of labor and 1 breathing technique. Okay, so in the last segment, we talked about the 6 preliminary signs. Those happen 2 to 4 weeks before you go into labor. These are the 3 biggies. Now, just to start, there is no sequence of events. That means any of these can be your first, second, or third sign of labor. But we always call labor when we see 2 of them. All right, so let's begin. In the last section, we saw this picture. All right, 1 actual sign of labor. In this picture, we talked about this little mucus plug. 1 actual sign of labor is when you lose the mucus plug. How do you know you've lost the mucus plug? Is when you find the mucus plug. How do you find the mucus plug? Well, you're in the bathroom, you've urinated, and something sort of trapped out. Not exactly sure what it is. Get brave, take a wipe and go, ew, what is that? Ladies, I describe it to you as a white plug of mucus, this big around, with a red to pink tinge to it. The way I describe it to you men, it's nothing you've ever seen before in your lives. Why do I say that? Because guess it gets called first to the bathroom when one discovers a mucus plug. Honey, can you come in here for a minute? I need a little help here. And you're like, yeah, sure. Wait a minute, hold it. As your husband's walking, wait a minute, hold it. Wait, it's not the mucus plug, is it? Because you promised me in class I wouldn't have to see the mucus plug. Get in here, I need a second opinion right now. So you guys sort of shuffle in. Okay, show it to me. Okay, Sherry was right. This is nothing I've ever seen before in my life. This has got to be the mucus plug. Why do we call it an actual sign of labor, and really what does it mean? Well, in order for this little pluggy thing to fall out, the cervix had to have changed. And in all medical dictionaries, they talk about cervical change equals labor. But by itself, the loss of the mucus plug does not mean you're in labor, by itself. So we look at it this way, 1 down, 2 to go. So in review, when I ask you to tell me the 3 actual signs of labor and I say, so what do you do with the mucus plug? The answer would be, well, we do nothing. What do you do with the mucus plug? You throw it away. You don't save it, you don't bronze it, you don't dry it out and put it in the baby's book. We trust you when you tell us you've lost your mucus plug. Now, I want you to know as a labor nurse, I've had many gifts as a labor nurse, and most of them come in baggies and Ziploc bags. And you have these women coming in like, hi, can I show you something? No. Just toss it in the garbage. I bet you it's the mucus plug. You don't need to show it to me. So 1 down, 2 to go. Okay? Another actual sign of labor is when you break your water. And I think this is what surprises most couples, is that it doesn't happen as often as everybody thinks it is. You always hear the stories of people breaking their water in grocery stores or wherever, but it's not that common. In fact, in 100 women who go into labor, only 20% break their water first. 80% have contractions, which is the 3rd sign. We'll talk about that in a second. But breaking your water happens in 2 ways. The first way is called the gush. The gush is best described when one is shopping at your closest market, and you're walking down some aisle, picking a thing out for lunch or something, and all of a sudden you look down and you feel, uh-oh, and you actually feel a champagne cork just popped inside you, and then there's a stream of fluid running down your legs, into your shoes, and onto the floor. There's a puddle forming at the base of your feet. Here's the dilemma. How do I get out of this store without anybody noticing? So I always tell people to run for the closest apple juice aisle, grab a bottle off the shelf, throw the darn thing down, and then drag your foot out as you're walking out the door. You don't want to make a big deal about it, but then you hear, over the PA system, clean up on aisle 6, lady with the butterfingers dropped the apple juice. Anyway, if you break your water, 3 things you need to do. And years ago, I had a dad in my class who was a writer, and he said, she has a mantra. When you break your water, you just need to remember 6 words. Sit down, note time, call doctor. Okay, so if you break your water, you are to sit down, note time, call doctor. So of course, I've always gotten the question, well, do you sit on the floor of the grocery store? No, you can go home first, okay? Go home first. Now, why do you sit down? Well, it isn't really common to first-timers, but I just have to tell you why we'd like you off your feet at this point. It's because sometimes the umbilical cord, if the baby is still floating, and most babies don't float, but if they're still floating, the cord can slip down in front of the baby's head. In fact, it's more common to second-timers because of what we said in the last segment about the babies float longer. So this is more common with second-timers than first-timers, but we just tell you to go home and sit down. You can take a shower. You can pack your bags. You can make your phone calls. You can move around your apartment at will or your home, but we just don't want you walking all over town. The second thing you do is note the time. Most hospitals in this country tend to go with what we call a 24-hour rule. Now, some hospitals don't. In fact, the more of the community hospital you are delivering in, the less this exists. But in some of the more urban hospitals, you'll find that there's sort of a 24-hour rule that we want to deliver the baby within 24 hours of breaking the water. And the reason why is because increase of infection, the risk of infection increases beyond 24 hours. And so that's why they sort of keep an eye on it. So sit down, note the time. And I kid you not, when you go to a teaching hospital, all they want to know is what time you broke your water. And they will say, hi, Chris, I'm the nurse in charge. What time did you break your water? 2 p.m. Thank you so much. Hi, I'm the resident of the floor. What time did you break your water? 2 p.m. Thank you so much. Hi, I'm the medical student. What time did you break your water? 2 p.m. The guy cleaning the floor next to your bed. Lady, what time did you break your water? It almost feels like everyone is asking you the same question because it puts a lot of people on the time clock. Like I said, if you go out to more of a rural community, you may find that it's 48 hours, 72 hours, and some people don't even have a limit on how long it can be. But some people start looking at the clock when you break your water. Okay? So that's your second actual sign. The second thing you do. The third thing you do is you call your doctor or your midwife. Everybody wants to hear when you've broken your water because it is an actual sign of labor. And we know that things are going to happen at that point. So you pick up the phone and you call. Now, everybody has a different way when they go into labor about breaking the water, and they want to call. And so, you're telling your doctor that you broke your water, and it's very exciting. And so this is my little scenario. Hi, Dr. So-and-so. Yes, I've just broken my water. What's going to be his or her first question? What's his or her? I just broke my water. What time? Thank you. What time? What time? 10 minutes ago. Uh-huh. What color was the fluid? Hold on. I have to check. It's all over the kitchen floor. Hold on. It's on the floor. It's clear. It looks clear. Honey, is this clear? I'm very anxious, and I'm very nervous all of a sudden. But is it clear? Yes, it's clear. Okay, clear is normal. Clear is normal. Yes. Clear is normal. Amniotic fluid should look like water. When you have an amniocentesis, as some people do in this life, you may see the syringe prior to the labor, and you may see that the syringe is yellow. Amniotic fluid at the beginning of your pregnancy is yellow, but it clears up and looks more like water at the end. So that's what we should see. But sometimes it comes out green. Green means meconium. Meconium is your baby's first bowel movement. It's dark green in color. You add it to amniotic fluid, and we've got pea soup coming down the leg in consistency and color. So when you see green, okay, Roger, when you see green on a traffic light, what do?
Mash on it.
Mash. You go. When you see green, you go. So the addendum to my mantra, if you break your water, you sit down, note the time, call the doctor, green means go. Clear means everything's fine, green means you're on your way to the hospital. And this is because for two reasons. What caused the green and what the green can do. What caused the green could be three reasons. One is because you've gone past your due date, which is a really common reason to see green. Another reason is if the baby's upside down breech, also very common. And the third and probably most problematic is if the baby's having some fetal distress. And that's a catch term for the baby's not getting as much oxygen as it should. So we need to see you as quickly as possible. But for you not to panic if you see green, and believe me, people panic when they see green, I want you to feel for the baby. If the baby's moving, the baby's okay. That means fetal movement equals fetal well-being. Okay, so let's throw it out there. If I asked you all right now, when is the most common time that you feel the baby? Most of you will probably notice the most is when you lie down at night. Is that not true? How many of you find that really it's entertainment at night, don't you think? You're lying on the bed and your husband's going, My husband would truly see body parts coming across, elbows, hands, feet, and say, who do you think that is? Because we got A and B in there. Who do you think that is? But it's truly entertainment at night watching that belly move. And some of you even notice when you do this to the belly at night that you actually get a reaction. Oh, pat, pat, ooh, he just kicked back. That's so cool. That's so cool. Okay, so if you see green, don't panic. But I'd really like you to feel for the baby. Because if the baby's not moving, that gives us one more reason why we need to get you to the hospital that much faster. But here's a really great trick that I've learned. If you want to get a baby to move because you're a little nervous about this, just poke and prod. Because what I just talked about with your husband doing this, poke and prod. And if the baby reacts, it's called action-reaction. You cause an action, you get a reaction. Okay, what else would get a baby to move? What have you found in your lives in the last few months that would get a baby to move? Anybody notice? Stephanie?
Sugar.
Sugar. Absolutely food. Anything sweet and cold. You put a candy bar down that throat and that baby goes, thanks, Mom. Thanks, Mom. Thanks, Mom. Hi, I'm here. I'm here. I'm here. I'm here. Don't forget me. I'm in here. Thanks. Okay, so you've got someone patting and poking. You've got somebody eating and drinking. And then in the last part of this section, I'm going to show you a breathing technique. And it's very similar to yoga breathing. It's just deep cleansing breaths. And when you start doing deep cleansing breaths, the baby tends to get more oxygen and starts moving around. So if any time in your pregnancy you wonder, gee, did the baby move? You know, I really didn't feel the baby this afternoon. Poke and prod, eat and drink and breathe. And I'll tell you right away you're going to get a baby to move. And it'll make you feel better too. So back to my discussion with the green. If you see green, don't panic. Feel for the baby. Poke around in there, get something in your mouth. I guarantee you'll feel a whole lot better heading to the hospital when the baby is moving. Now, more times than not, you're going to see clear fluid when the water breaks. So I don't want you worrying about the green because we can handle it. It also means that you're not having an emergency C-section. It just means that we're going to be evaluating your labor, evaluating your baby, and making sure everybody's okay because green is pretty common. It's nothing unusual for us. All right? So sit down, note time. I say it enough times that it just sort of sticks in here. Sit down, note time, call Dr. Green means go. Now, the first way of breaking the water is called the gush, which I just described. And that's when this part of the bag breaks. This part is called the forebag. But then what happens when that breaks, the head moves down and creates a cork to all the fluid behind the baby's head. So ladies, let me warn you, it's not one gush followed by nothing. It's one gush followed by lots of little gushes. So I was once working at the hospital, and this woman comes waltzing down the hallway in this long black flowing dress with a white towel hiked between her legs, and she's like this, coming down. I'm like, you have to tell me, what's this about? Well, I broke my water in the restaurant, and this is all they could give me. So you don't want to find yourselves, you know, in the middle of a taxi cab dripping all over the back seat because you didn't think to put a pad on. So be prepared because you will continue to leak. It's not one gush and you're done. There's lots of fluid yet to come. But the second way of breaking the water, which is a little more confusing than the gush because it's so obvious, the gush, is what we call the high leak. And the high leak is when there's a teeny tiny rupture up above. And all that happens is when it breaks, it just trickles out. Now, ladies, we've had a lot of trickling out over the last few weeks, I'm sure, if not months, because you know what you gentlemen don't know is a cough is no longer just a cough, and a sneeze is no longer just a sneeze. Achoo! There's always incontinence going on with pregnancy, so that's just part of the plan. But when you get this little trickle coming out of your vagina and think, what could that be? Okay, that was 15 minutes. And then a little trickle. What could that be? Maybe the baby just kicked the bladder and then another little 15, must be that massive vaginal discharge she talked about earlier on. Yeah, that must be it. I don't know what this is. And then an hour goes by and you're still leaking and you don't know what it is. I know this sounds totally gross and disgusting, but if you're wondering what's trickling out of you, put your hand on it and sniff it because amniotic fluid has no color and it has no odor. Urine smells, vaginal discharge smells, but amniotic fluid has no odor. So I'm once teaching this to a couple in their home, you know, they're on the living room couch, and I said, so, if you don't know what it is, sniff it. She turned to her husband with the most serious expression. Phil, you're going to have to sniff that for me. My nose has been all stuffed up in the pregnancy. Peter, can you just check this? Just came out of me. I'm not sure what I thought the guy was going to fall off the couch. I said, I'm not sniffing anything, honey. I'm out of this picture. So, same rules apply. If you break your water in the gush or the high leak, the same rules apply. Sit down, note the time, call your doctor. If you've got pea soup coming down your leg, you'll know immediately what it is. There won't be any questions there. But better safe than sorry. If you're still not sure about whether it's a leak or a gush, just make a phone call and say, I think I'm leaking. I'm not sure. Because we have tests. And we can just test it with a little litmus paper. And if it turns blue, voila, you broke your water. If it didn't, we'll send you home and say it's probably that vaginal discharge we talked about. Okay? So, if you break your water, like I said, I repeated 100 times. Sit down, note time, call doctor. Green means go. That's your second actual sign. Third actual sign of labor is contractions. This is the first time I pulled this chart out, and you're wondering what the heck you're looking at here. Well, let me just, first of all, clarify something about TV. When you see on TV, they're coming every 5 minutes, doctor. They're coming every 5 minutes, doctor. They're usually rushing families down hallways. They're pushing people into delivery rooms. Everybody's rushing things are throwing all over. Every 5 minutes, if we're lucky, For a first timer, now, Chris, you're the exception here, but every 5 minutes for a first timer only means that your cervix is only about 1 to 3 centimeters at 5 minutes. We still have hours to go. So everybody's always worried that they're not going to get to the hospital in time. I'm not going to get to the hospital in time. 3 centimeters, that's all it is. So we're not going to be in a hurry. But what you're looking at here is 3 different labor patterns. And we're going to be going through that in the next segment when we talk labor. This is your early phase of labor, this is your active phase, and this is your transitional phase. And as you can see, the contractions change. But let me explain what you're looking at here. When women are in labor, they're placed on monitors. And 2 monitors, one tells us the baby's heart rate and one tells us the contraction pattern. When you put it on the contraction pattern, contractions show up as waves. So the waves are simple. You see them, but when you see they're coming every 5 minutes, doctor, what does that mean? How are we timing those 5 minutes? We always, and no other way, time your contractions from the beginning of one to the beginning of the next. That's the only way. I don't care how long the actual contraction lasts. I don't care what kind of downtime you have. All I care about is how often they're coming from start to start. So that's how you measure contractions. Now let me explain something here. When this contraction starts, it starts slowly, hits a peak, which is the most painful part of the contraction for everybody, and then it comes down and gets a whole lot easier. The flat line, what does that mean? That means no pain. I think a lot of people have this impression that labor is just painful all around all the time. It's not. It's pain, no pain. Pain, no pain. And I think what people make the biggest mistake is when they have the downtime, they don't enjoy it. They don't take it for what it's worth. They sit there, and I want you to know, when I worked in the hospital for so many years, this is what happened. The contraction ends, and what you should do is do this. Wow, that was really so much better. I'm feeling so much better. There's no pain. I love that. However, this is what happens when you come off a contraction. What I see, come off the contraction. I don't want to do this anymore, and I'm really getting scared. And where's the anesthesiologist? Honey, you promised me an epidural, and why am I... Here's your big chance to relax, and instead you just make it a big deal. So enjoy it when you've got it. Enjoy the downtime. So for first timers, when you're having a first baby, most doctors, midwives, or any caretaker that you're working with doesn't want to hear from you. Truly, if you're just having contractions alone, until the contractions are coming every 5 minutes for 1 whole hour. Every 5 minutes for 1 whole hour, which translates into 12 contractions. Okay, Chris, for second timers, it's every 10 minutes for 1 whole hour. And the reason why it's less timer is because you're going to go faster. And at 10 minutes, things are going to start cooking. So we'd rather have you, call us a little sooner because we may say, she's going to go faster. But the rest of you first timers, every 5 minutes for 1 whole hour. Now, the doctors I've worked with over the years, I used to work in a very big urban hospital in New York, that they love to chat with the mothers on the phone when you call with the contraction information. They want to talk to you. And everybody experiences pain differently. Everybody has a different perception of pain. It's a cultural thing. So here's my first scenario. Hi, Dr. So-and-so. Yes, I'm contracting every 5 minutes. I was told to call you now. Uh-huh. I'm feeling fine. Yes, I feel so good. I can't believe it. In fact, they feel like menstrual cramps. I thought it was going to be... The weather outside? Why are you asking me about the weather outside? I just told you I'm in labor. What's he or she doing? What are they doing with you chatting on the phone? What do you think they're doing?
Waiting for the next contraction.
What are they waiting? They're waiting for the next contraction, George. That's exactly right. They're waiting for the next contraction because they want to see what you do with the next contraction. Uh-huh, no, my mother-in-law doesn't live in town. We're not very close anyway. Uh-huh. So no, I'm having one right now. Yes, I'm having one right now. Yeah, oh, very reasonable. Like a menstrual cramp, as I said before. So listen, I'm so excited. It's the first baby and everything. Should we come in? Not yet? Can you tell me when yet is? I know, but I thought this was labor. I'm sorry I'm getting a little emotional, but I thought this, you know how it is with pregnancy. I just thought I would be coming in. I know, but my husband, I told him to come home. He's going to kill me when he hears that we're not going in. I know, but okay. So tell me again when I'm supposed to come, when I can't talk through the contraction. But how am I supposed to call you if I can't talk through the contraction? This is it. Okay, I'll have him call. I gotcha. Okay, sorry about the crying. Yeah, I know. I thought I was, I know. Okay, bye. Believe me, when you think you're in labor and someone tells you you're not, it's going to be very upsetting, okay? The second scenario. Hi, Dr. So-and-so. Listen, I'm contracting every 5. They're kind of getting strong now. Yeah, listen, I'm having one now. Would you just hold? Just hold. Just hold! Yes. Yes. I'll be there in 15 minutes. Click. You see, the way we look at it is you should call us at every 5, but don't come in till you can't talk through it. Because in most institutions, if you show up with a big smile on your face, hi, I'm in labor. Yeah, I'm really in labor. Guess where you're going?
I go.
Home. Scoot you right out that door, lady. You're not in labor because look at you, look too happy. Too happy. Go home, go home. Labor's painful. Go home. So if you walk in too happy, we're not going to take you. We're just going to turn you around and send you home. So my advice with this whole thing is wait until they bother you. You can call it every 5. It gives everybody a heads up that you're in labor. In fact, if you're dealing with a doctor who's got a schedule and has patients all day in their office, you're giving them a chance to sort of look at their schedule and redo it. But do you need to come in right away? No rush and hurry here, ladies. No rush and hurry, because if you do, you're going to end up being sent home. And then you're going to think, oh, we just came in for nothing and we made this trip and oh, boy. I know it's a really hard sell to tell women to stay at home in labor because it's so scary for some of you. But I want you to know women have an inner wisdom for birthing a baby. They really do. And if we just left women alone and just said, here's a couch and here's a tub and here's a shower and find the most comfortable place to be in, I guarantee you those are the places you want to be and moving around. So it wouldn't be someplace, oh, gee, let's go to the hospital and lie down and, oh, guess let the monitors and the IVs, because that's way too medical for this at the beginning. That can come later. But at the beginning, you should really try to see if you can labor a little bit at home because it's going to make it better for everybody, especially you ladies, especially you ladies. Okay, so the 3 actual signs of labor are simple. Number 1, oh, you know what? Never mind. I'm going to check with you. Are you going to tell me? Because why not do a little review here? So there are 3 actual signs of labor. Back to you, Peter. Give me 1.
Water break.
Water breaks. The first thing you do, Lisa, the first thing you do when you break your water.
Sit down.
Sit down. That's all. George, give me a second thing.
Note the time.
Note the time. Steph, third thing. Call your doctor. Sit down, note time, call doctor. Roger, what do you do if the fluid's green?
You don't smell it.
You don't? No, you don't smell it. So what do you do instead?
Call the doctor.
Call the doctor and green means?
Means
Green means?
that the baby had its first palpable.
Okay, but, okay. What do we
Could
see
be
green under
breech.
traffic light? Green under traffic light. What do you do?
Gonna go to the doctor.
You go to the hospital. Okay, sit down, note time, call doctor. Green means go straight to the hospital. By the way, you should probably call your doctor ahead. Make sure you call before you get there because in some places, you may make it there before your physician does, and they want to have a heads up you're walking in the door. Where at my place, it would be that if they didn't call, we wouldn't know why you'd be walking in the door. So it'd be easier if we knew ahead of time, even if your doctor's not there. Okay? Joanna, give me a second actual sign. How do you know you're in labor besides breaking the water?
Mucus plug.
Oh, wait, you know what the problem is? We got Joanna and Joe next to each other, so I keep asking Joanna, and Joe answers. It's like a ventriloquism thing going here. All I have to do is ask Joanna, she's ready to answer, and Joe picks it up for me. Yeah. Joanna, darling, give me another actual sign of labor.
The mucus.
The mucus plug. Boy, I love it when people make the mucus plug. Very good, the mucus plug. And what do you do, Joe, if you lose the mucus plug by itself? What do you do?
Toss it.
Toss it, baby, toss it. You know, people start getting nervous because I start giving them all these instructions, and then when it comes to the mucus plug, they're like, was there instructions? I forgot you talked about that first. You toss it. Last actual sign, Rhodey, give me the last actual sign. We already lost the mucus plug, we broke the water, what else could possibly happen? Contractions. So Chris, for a second timer, my dear, when do you call?
10 minutes apart.
Beautiful. For Lisa, when do you guys call?
5 minutes.
And how do we measure contractions, George? From what to what?
From start to start.
Oh, he's paying attention. Do you know how many
Yes.
people? Yes, yes. Do you know how many people I've said this? So how do you measure? And I was a guy that I have worked with, from peak to peak, from end to end, from pain to pain. I'm like, well, okay, I can live with the pain to pain. So it's always from start to start. And I think that's where people get stuck is they just don't time them properly. So like I said, we don't care how long they last. We don't care what kind of downtime. Just give me what's happening from start to start. All right? Okay, so you got them all. Beautiful. So it's 3 o'clock in the morning. You're already up. Oh, I have to pee anyway. I might as well get up. And yesterday was my due date, and I don't know what's going on, but I've been feeling kind of crappy all day today. Kind of crampy, kind of crappy. I feel kind of fluish. I don't know. I've had a little diarrhea yesterday. I'm just not feeling good. So I get up. I plod across the bedroom carpet. I get into the tile bathroom floor, and all of a sudden I feel an unbelievable sharp pain coming on. Oh, honey. Oh my gosh, I just broke my water and the mucus plug's on the floor. What do I do first? George, what do I do first?
Gotta sit down.
I'd sit down. Stephanie, what else do I do?
You know the time.
Note the time.
Call the doctor.
Call the doctor, Roger, thank you. And if it's green, Joanna, what do I do if it's green?
Go to
Go to the hospital. Joe, if it's clear, is everything okay?
Everything's
Wonderful, beautiful. I do that with everyone, and every once in a while the classes go, you wait for the next contraction? Why? You see, the one thing is that when you meet people on the street that say they were in labor for 72 hours, they probably were in labor for 72 hours because there are some women who get stuck in a long labor. It's called prodromal labor. Very common. And it just goes on and on. The only problem with it is that it's just very upsetting to parents because they think they're supposed to have a baby in a day, and that's it. And why should I be in labor for 20 hours and 40 hours and 72 hours? But there's no time clock on a labor like that. We don't put a time clock. The only thing we put a time clock on is when you rupture your membranes, when you break your water. Okay, so that's why that scenario is important, so that people realize that, yeah, okay, we broke the water, that puts them on a time clock. If you just have contractions, we just wait. We just wait. All right, do you have any questions on the 3 signs of labor? Stephanie.
I heard that when your water does break, if you lay down, it gushes more, and if you stand up, it stops. Is there any truth to that?
Well, when I showed you the picture, what do you think? Why would you think that's
Well, when the baby's head comes towards the cervix.
Exactly,
it's
the baby's
plug-in,
head. You
basically,
got it.
right?
Gravity is your best friend. You stand up, baby goes down, sits on that cervix, and all that water stays behind. You lie down, and it's true, because you're in the hospital, you lie down, and all of a sudden everything starts dripping out of you because the baby's moved out of range. Perfect question. Absolutely, that is true.
Okay.
Any other questions? Joe?
Yes, what about the rare times where you may not feel a strong contraction? I know I was a special baby.
You were a special baby, Joe? What does that mean?
My mother, she didn't feel barely any pain
contractions?
at all. And they tried to send her back home, and she said, this is it, and it was a
But you know what? She knew it. See, that's the thing, is that there are women who walk in and they say, no, you're not, no, it's not so bad. No, I know it's coming. And that's the whole, what we call inner wisdom of women, is that they do know. There are women who have very easy labors. They are women, and I have met women who said, I did it under 4 hours, and it was I just spit that kid out, it was nothing. And then you hear the stories of the women who show up at the door of, labor delivery, and that head is crowning. I mean, and I have seen that. Believe me, I've seen that. So it does happen. It's rare. And you really have to understand why there's pain in labor, and I think that's where the confusion lies also. Is this pain in labor? Why? Because it has to give you a forewarning. It wants, the body has to give you, hey, we're having a baby. The last thing you want to be doing is standing on a street somewhere going, and this is why people call me and say, well, will I know that I'm in labor? Will I absolutely know your mother knew. The powers that be at the hospital had no clue, but your mother knew. And it's rare, when you hear the stories of babies that are delivered at home, it's not first babies that you usually hear that from. You usually hear the second babies come faster, and that's why those women don't make it. But I promise you on my nurse's license, you'll know it. You won't be standing in your living room doing this. Honey, the baby just dropped on the floor. Did anybody see what happened here? Did anyone see what the baby's on the floor? I promise you that won't happen. It's the second timers that you hear the stories, you read, baby born in taxi cab on the way to the hospital. Those are the mothers that aren't paying attention as much as they should be as far as their labor goes. But the first ones take their time. So in your case, you were the special baby, Joe. Special baby. All right. Any other questions? Roger?
Since the amniotic fluid protects the baby,
Yes.
basically,
Okay.
are there any safety concerns then after once the water starts to go?
No. And here's the good news, is that the placenta continues to produce amniotic fluid even after the baby's born. So it's not like you're ever going to leak out too much that there's not enough for the baby to be born behind. So I think that's a big surprise too. People always say to me, well, I heard about dry births in the old days. I mean, it just doesn't happen because there's always fluid being produced inside from the placenta. So that's the protection factor that your baby has. These are great questions. Anything else, guys? Okay, let me explain something. The last part of this section has to do with breathing. And I would have to say that being a Lamaze instructor, people always come to class assuming that they're going to be doing a breathing class. That's all they do. Sherry, are we going to be breathing, ting, ting, put the incense on, ting, ting, No, that's not what this is. Actually, Lamaze has changed in many, many years, and it's now a philosophy. It's not even a technique anymore. We don't spend a lot of time doing techniques. We talk about normal birth, and we talk about that it's okay to labor, and it's okay to stay at home, and it's okay to feel what you're supposed to feel, and that's all normal. But where the breathing comes into play is it's a way to keep people calm. It's a way to people to get to their point where they need to be comfortable. So we've sort of thrown out all of those breathing techniques because for 20 years I taught them, and women would call me and say, I used the first one, but the second and third one went out the window. And if you're watching TV, you're always going to see someone on TV, some sitcom, where the woman's going, and they look ridiculous. And that's why nobody wants to do them, because they think of themselves saying, God, I'm never going to do that. I won't breathe that way. So it's just so much easier just saying, you know what, let's find a breathing technique that works for everybody. And almost every technique out there, there's Bradley, there's all kinds of different techniques in labor or in education that we just say, just slow chest breathing, and that's all you need to find a place where you're comfortable. So there are 4 rules of breathing. The first rule is you need to have a focal point. A focal point is an immovable object, a vase of flowers, a lamp, anything you can stare at, a picture behind me, something that you can stare at for an entire minute. Because in a scheme of labor, most of your contractions will last a minute in length, so you want to be able to breathe for that amount of time. When you're working with a partner, it's always nice if he can tick off the 15-second intervals, because during a contraction, the contraction starts, and then at 15 seconds you're there. At 30 at the peak, you're at the top. 45, you're coming down, and 60, you're done. So if you hear the numbers, it gives you a place to be in that labor. You know where you are, and you're almost finished, and that's a nice feeling. And the third is, we talked about the focal point before already, and the timing. And the only thing left is that you don't use it till you can't walk, talk, or joke through a contraction. And that's a really hard one, because you're still feeling good and you should be breathing, but you don't need to breathe until you really can't get the words out. So really, what is this breathing technique? It's simple. I'm going to demonstrate it, and I'm going to have you do it for me. All right, so I've got my focal point. I'm trying to relax my body. I'm going to start my breathing technique with a cleansing breath. A cleansing breath is a deep, deliberate, in through the nose, out through the mouth. And that is a marker. It's a signal for the coaches, the supporters, the people who are in the room with you that know that you're starting that contraction. And at the end of the breathing technique, you end that contraction with a cleansing breath. Okay, so let me just demonstrate it for you. Now you do slow chest breathing. In through the nose as slow as you can go. Out through the mouth as slow as you can go. And you repeat that breathing for the entire minute. Now, normally women breathe pretty quickly, especially when you're pregnant and you don't have much room to breathe. So most women go, and when they do this technique, they get a little anxious as well. So coaches, if you would tonight, or supporters, would you just keep an eye on how often she's breathing? We don't want her going about 12 or 15 in a minute. We want her to go about 4 to 6 to 8. And that means it's just a really easy-going breath. And I will talk you through the whole thing so you know where you're at. Okay, so ladies, find a focal point around the room, something you can stare at, not your husband's eyes today, okay? Because when that happens, we start the giggles big time, all right? So look somewhere else, all right? And I'm going to just talk you through a whole minute here. So you're going to start with a cleansing breath, which is very deep and deliberate, in through the nose, out to the mouth, and then slow chest breathing, and then the contraction will end, and you'll do one more cleansing breath, and we'll be finished. All right, so contraction begins, cleansing breath. Blow it out. Now slow chest breathing, in through the nose and out through the mouth, as slow as you can go. Nice and easy. That's 15 on the clock. You're doing great, ladies. Really keep an eye on that focal point. Just concentrate on just the breathing. Just go into that zone of just the breathing. In through the nose and out through the mouth. That's 30. You're halfway there. In through the nose and out through the mouth. Doing great. Keep it up. You may even feel the baby kick around a little bit. This is the breathing technique I was talking about before. That's 45. You're almost finished. In through the nose, out through the mouth. Nice and easy. Keep it really calm, really relaxed. And contraction ends. Give me one more cleansing breath. And blow it out. And those are what you need at the beginning, middle, and whatever you need to get through the contraction. It really is a good distraction method. When you talk to people who do yoga and meditation, they find it's the same kind of breathing. The only difference is the breathing goes in through the nose and out through the nose. Whereas in this breathing technique, it's in through the nose and out through the mouth. And it just gives your partners a chance to really keep an eye on what you're doing, so that you know, oh, I'm starting a contraction, I'm ending a contraction, I'm right in the middle. And some people will speed it up as it gets harder, the contractions will get stronger, and you may find them doing, but that's okay. There's one other component of breathing that you should know about, and that's relaxation. I think that a lot of people don't think of that as being an important part of this, but it really is, because when you relax your body, your uterus works a little bit harder. So if you find, gentlemen, that she's breathing and she's like grabbing your arms, or she's, holding onto something really tight, and she's got her hands wrapped around, an arm, whatever, the nails are digging in, just watch that, because I don't know any woman who does not love getting massaged. And during labor, it wouldn't hurt if it's like, okay, honey, okay, let's relax that arm. Hey, you want me to do a little foot massage? I often find men, if they're at the bottom of the bed or at the bottom of the feet, the women are much happier. When they start doing this to your tummy, get away from me. Here is where I want you, at the bottom, because it just makes it feel a whole lot better. So don't be afraid to massage your wife. I think she'll love it. Any questions about the breathing? That completes the second section, the section on 3 actual signs of labor and 1 breathing technique.